In this video, we are going to learn about the inguinal canal and some of the hernia. Inguinal canal is made up of roof, anterior wall, the posterior wall, and the floor. In this image, we can see that inguinal canal is made up of anterior wall, roof, posterior wall, and floor, as I said already. Anterior wall, there is in the lateral side, this is the lateral side and this is the medial side. On the lateral side we have superficial ring, and this anterior wall is made up of the external spermatic fascia. On the medial side, this part of the wall of the anterior is made of internal oblique muscle, some part. In case of the posterior wall, which is made up of the transverse fascia, this much. And here we can see on medial side, over here we can see a deep inguinal ring. This portion, which is lateral portion of the posterior wall, is made of conjoint, which is formed by the fusion of the transverse abdominis muscle and internal oblique muscle. On the floor area, we can see a inguinal ligament, like here. Spermatic cord enter the inguinal canal through the deep inguinal ring, and it releases through the superficial inguinal ring, like this. Enter the deep inguinal ring, comes comes out through the superficial inguinal ring. These spermatic cord in male contain the vas deferens, and in female it contains the ovarian ligament or round ligament. As I already mentioned, the transverse fascia will form the posterior wall of the inguinal canal. When it goes medially, there is a conjoint tendon which forms the posterior wall, which is formed by the fusion of the transverse abdominis muscle and the internal oblique muscle. The roof will be formed by the transverse abdominis muscle and internal oblique muscle, which can be seen like here. This is the roof, and the floor is made by the inguinal ligament, and we can see that over here. This is the uh, floor I mark here. This is the floor over here. So, anterior wall of the inguinal canal is the external spermatic fascia, which is over here. We can see here that the inferior epigastric vessel, which is present medial to the inguinal canal. The inguinal canal is formed by three fascias. One is the transversalis fascia over here, and another is the climatic fascia, and last one is external spermatic fascia, which is outside, and this one is inside, this is middle, and this is outside. Medial to the inguinal canal, we can see a rectus abdominis muscle. So this is the normal anatomy of the inguinal canal. So let's go through the hernia. In case of diaphragmatic hernia, the abdominal structure will be entering into the thorax. Normally it occurs due to the defect in pleuroperitoneal membrane or due to the trauma of this membrane. It is usually occur in the left side because there is a more protective structure on the right side by hemidiaphragm of the liver. Most common herniation is hiatal herniation. We can classify it as hiatal means the esophagus, and we can classify hiatal herniation into two. One is the sliding hiatal herniation and another one is a paraesophageal herniation. Sliding hiatal herniation means that it is sliding through the space, through the normal orifice of the esophagus, like here. So this lead to the hourglass appearance like this. So these have more association with the GERD, because the gastric content can easily goes out through this space. And here we have the paraesophageal hernia over here. Here it is not going like the sliding hiatal hernia. It is herniating through the gastroesophageal junction, and the fundus portion is herniating upward into the thorax. In case of the indirect inguinal hernia, in case of the indirect inguinal hernia, the interstitial loop will be herniating through the same space that moves the spermatic cord. Like it moves through the deep inguinal ring, like here, and then it passes through the superficial inguinal ring over here. Lateral to the inferior epigastric vessel. It is most caused by the failure of process vaginalis to close. As a result, it will be here is a process vaginalis. If it is not closed, it is coming outside into the scrotum. So this is most commonly in the male people. In case of the direct hernia, we can see the interstitial loop which directly herniating through the superficial inguinal ring over here. It is not passing to the deep inguinal ring. Here we can see this hernia on medial to the inferior epigastric vessel, but here it is lateral to the inferior epigastric vessel. Direct inguinal hernia, which can be seen medial to the inferior epigastric vessel, but laterally to rectus abdominis, and it is moving through a triangle called the Eisenberg triangle. We can see on this image. On this image, we can see that here is the triangle. So this hernia is medial to the rectus abdominis muscle over here, and this hernia is laterally in the lateral side of this hernia. We can see the epigastric vessels. In case of the direct hernia, only one layer that is covering the direct hernia portion. If that layer is the external spermatic fascia, which is outer layer. The femoral hernia, which is protruding below the inguinal ligament, it is over here. This is the loop of intestine, and this area is called the femoral triangle. We can see on this image, and here in this image, this femoral hernia, it is mostly associated with the female than male. And in case of the femoral hernia, we can see more inoculation, means it is going out through the weak area, or the strangulation which undergo necrosis. These things is most commonly seen in the femoral hernia than that of the inguinal hernia. But while comparing to the femoral and the inguinal hernia, there is the more case is for inguinal hernia. Like the inguinal hernia patient is mostly seen in the world than the femoral hernia.